Why are urodynamic tests used for bladder diagnosis? Have you ever wondered how doctors figure out what's going on with your bladder? Urodynamic tests are a key tool in understanding bladder health. These tests help evaluate how well your bladder, urethra, and urinary sphincters work together to store and releases urine. They provide important insights into the pressure and flow of urine in the lower urinary tract. So, why are these tests so important? First, they help doctors measure troublesome urinary symptoms. If you experience issues like urine leakage, frequent urination, or painful urination, urodynamic tests can objectively measure these problems. They can also help identify sudden strong urges to urinate or difficulties starting urination. Another reason for these tests is to assess how much urine your bladder can hold and how effectively it empties. This is crucial for understanding bladder function. Urodynamic tests can detect involuntary bladder contractions that may lead to leakage, which is essential for diagnosing conditions like overactive bladder. These tests also evaluate how well the bladder and urethral sphincters coordinate during both filling and emptying phases. This coordination is vital for normal urinary function. When symptoms are unclear or when initial treatments haven't worked, urodynamic tests can help diagnose lower urinary tract problems. Additionally, the detailed information gathered from these tests guides treatment strategies. By providing precise diagnostic data about bladder function, healthcare professionals can tailor treatments to meet individual needs. Urodynamic testing involves specialized equipment and fine catheters that are inserted into the bladder and sometimes the rectum or urethra. These instruments measure pressures and muscle activity. The tests can range from simple observations to complex measurements that assess pressure-flow relationships and nerve activity. In the context of bladder health and bladder cancer, urodynamic tests play a vital role. They help distinguish between different types of bladder dysfunction and monitor treatment effects. Importantly, they ensure that symptoms are not due to functional issues that may need specific interventions. Overall, urodynamic testing is the only method that objectively evaluates the function of the lower urinary tract. This makes it essential for accurately diagnosing and effectively managing bladder disorders. If you have concerns about your bladder health, it's always best to consult a healthcare professional for personalized advice.